all about Perthes. Leg Calvé-Perthes disease, or Perthes, is a rare childhood hip condition occurring in 1 in 10,000 children. Perthes disease occurs in 4 stages. The initial stage, or necrosis, is when the blood supply to the femoral head is disrupted and bone cells die. This stage may last for several months. The next stage is fragmentation, when the body removes dead bone and replaces it with initial softer bone. Due to the weaker state of the bone, the head of the femur is more likely to break apart and collapse. This stage may last for 1 to 2 years. Reossification is when new, stronger bone develops and begins to take shape. This is often the longest stage and may last for a few years. The final stage is when the hip has healed. Bone growth is now complete, and the femoral head has reached its final shape. For some children, the femoral head remains misshapen, which can lead to ongoing hip pain, early onset osteoarthritis, and/or necessitate the need for a hip replacement. One of the earliest signs of Perthes is a change in walking or running style, such as a limp. This is often the most apparent during sports activities. Children with Perthes may also experience pain in the hip, groin, or other parts of the leg that may worsen with activities. Areas around the hip may also become inflamed and irritated and be accompanied by painful muscle spasms. In other cases, a child may feel no symptoms, and the condition may not be noticed and diagnosed until an X-ray is taken due to a fall or other injury. The cause of Perthes disease is currently unknown. Perthes typically occurs in children between 4 and 10 years old, but most commonly presents before the age of 8. It is 5 times more common in boys than in girls. Other risk factors for Perthes include family history, low birth weight, abnormal birth presentation, secondhand smoke. Treatments focus on relieving pain, protecting the shape of the femoral head, and restoring normal hip movement. Doctors must consider several factors when deciding on the best treatment, such as patient age, amount of damage to the femoral head, stage of the disease at the time of diagnosis. Some non-surgical treatment options include observation and monitoring with X-rays to check disease progress, medications to reduce inflammation, limiting or avoiding high-impact activities such as running and jumping, use of crutches or walker to limit weight bearing, exercises to restore range of motion, casting or bracing to keep the femoral head in position within the acetabulum. Surgery may be recommended for some patients to keep the femoral head within the acetabulum until healing is complete. Most often, surgical treatment is recommended for children when they are more than 8 years old at the time of diagnosis, more than 50% of the femoral head is damaged, non-surgical treatment has not been successful. Long-term outcomes for children with Perthes are good in most cases, and after 18 to 24 months of treatment, most children can return to their regular daily activities without major limitations. Like all hip disorders, early detection and diagnosis is key. If you notice or suspect something might be wrong, see your family doctor. For more information about Perthes and other hip disorders, or to make a donation, visit www.imahippie.org.